Welcome to the Gold Coast Plastic Surgery Podcast. I'm Dr. Mark Doyle, specialist plastic surgeon with over 30 years experience. Today I have with me my friend Alana. Today we're going to be talking about all things plastic surgery.
Mark,
Yes.
This breast implant will look different on two different women. Is that correct?
That is correct. Thank you. And the reason for that is people are different. It's all about chest size, symmetry, and the patient in general. We don't see two people that look exactly the same in the same body shape. Therefore, to expect to see the same result using the same size implant on both people just doesn't happen. It's quite common for me to see people come into the office and say, oh, my girlfriend had such and such, so I'd like something the same. And she comes in with a girlfriend, and one girlfriend's 5 foot and the other one's 7 foot. And you sort of go, this is not going to work. You've got to have a very similar body shape and body dimensions to be able to get the same size breast using the same size implant on two different people. I think it's a good idea for me to explain the fact that the volume of the implant doesn't necessarily correlate with the dimensions. And for what that I mean is you have an implant that is, say, for example, 400 grams, and that 400 gram implant can be 400 grams but mainly pointing out, more projection, or it can be flatter but still be 400 grams. So there's quite a variation in the implants themselves as to what the dimensions are, even with the fact that they may have the same volume. So the way we would normally do it, and the way I would make a decision about how to size people for implants, is pretty simple. I've got my friend behind me here. Let's have a look here. So the first thing I want to know is the width of the chest, which is really from the middle here out to the outside of where the breasts want to be. So this dimension across here. So I'm looking from here to here. This dimension here will give me an idea as to what implants will actually fit them. And if I put an implant in that's too broad, there's only two things can happen. They'll either hit in the middle, in which case you get a mono boob, or you get too much cleavage or no cleavage because the whole part of the chest wall here comes out, and you just have one really big breast all the way across. Or alternatively, if we get it right here, then it sticks out at the side too much, and people don't like a lot of side boob, is the technical term that I get all the time from the patients. So we need to get that measurement, and that immediately then determines what implants will actually fit the chest. That's my decision usually because I do the measurements. The other variable in the implant is how much do they stick out. And they can stick out a little bit or a lot. That's cup size and its projection. So when we order the implants, we look at, first of all, an implant that's that dimension across. They get the choice as to what cup size they want to be. So if they say, okay, I'm a B and I want to be to a D, we'll need an implant that has more projection in this direction in order to get the desired result. Then the third discussion is, do I want a lot of fullness up here or not? Now, more fullness up here gives a completely different looking breast, and some people really like that full upper pole of the breast, some don't. So we have an option of different sorts of implants that will either make this more prominent or less prominent, and again, that's a patient decision, and it depends on what their outcome is, what they want to look like. Afterwards, we have those discussions. I advise people on which I think would be the best for them, but that's the final decision. So the summary is pretty simple. Get the dimension of the chest. That doesn't change. That limits the number of implants that we can select. Work out whether you want more cleavage. If you want a little bit more cleavage, we can make that a little bit wider. If you want less cleavage, we'll make it a little bit less. If you like breast outside in the armpit area, we can make that a little bit longer. So we've got a few ways of adjusting that. The other is how much do they come out, the cup size, and there are multiple different implants that we pick from that allow us to get the right amount of projection. And the third part of this is just, do we want fullness up on the top of the breast or not? Now, all of that is different with each person. Therefore, if I wanted to put this particular implant into two different ladies, it will be different because all those dimensions are different.
If I see a picture of breasts of a celebrity that I really like and I bring that photo into you, how do you usually respond to that?
Well, because it gives me an idea as to what you want to look like.
Okay.
So I really encourage people that come into the office to come in with their wish pics.
Okay.
And the wish pics are, get online bring me photos of breasts that you like the look of and breasts that you don't like the look of. That gets me in the same headspace, and that makes it easier for me to make a decision. We don't know, looking at what they come in with in terms of the celebrities, is what their actual dimensions are.
I see.
But having got that bit of information is enough for me to be able to go, okay, I can select some implants that'll give you the same sort of effect.
Okay, that's interesting. So I should come in with pictures of breasts I do like the look of and breasts I don't like the look
Correct.
of, and that will give you an idea of what kind of breasts I would like relative to my shape and how you can create it.
And the other thing is interesting with those photos, a lot of people's breasts change very dramatically if you've got a push-up bra. So it's really important if we can get I'd rather see photos of people in bikinis and things with less push-up so I've got a better idea on what the breast looks like underneath.
Less structure underneath the breasts in the photos is optimal.
Is optimal, yes. That's a nice way of putting it.
Good tip, thank you. I think all women have the experience of taking in a picture of Kim Kardashian's hair and being slightly disappointed with the experiences that you walk out of the salon with. So what are realistic expectations when we come to plastic surgery?
Well, exactly that. They need to be realistic, and it's my job looking at the photos and then showing the different implants that you're going to get something that's realistic. It's never going to be exactly the same, but it's going to be close.
Okay, that's good to know.
Thank you for joining us today on the Gold Coast Plastic Surgery Podcast. It's been a pleasure to have Elena with me today, and I hope we've answered some questions that you find relevant.